The burden for women is probably more pronounced than it is for men, because obviously women are the caregivers at home and increasingly for their parents as well. So there's a lot that women do. And in addition to that, the treatment has negative consequences generally for fertility. So for younger women in particular, this is problematic. My name's Chris Tanti. I'm the CEO of the Leukaemia Foundation. I've been with the foundation now for nearly 5 years. We're an organisation that provides support to people living with a blood cancer, and in fact we've sort of broadened that to other types of cancer in our accommodation. We provide accommodation support. Largely our services are geared towards people living in regional, rural and remote communities who have to move to the city to get treatment. Financial assistance, psychological support is another thing that we do, and provide information to people newly diagnosed. We run a whole range of online support groups, etc. And we do this nationally. Well, in 2024, 8,300 women were diagnosed. Of those, sadly, 2,500 lost the battle with blood cancer and died. By the time we get to 2035, that number is set to double. Nearly 15,000, 16,000 women will be diagnosed with a blood cancer. The burden for women is probably more pronounced than it is for men, because obviously women are the caregivers at home and increasingly for their parents as well. So there's a lot that women do. And in addition to that, the treatment has negative consequences generally for fertility. So for younger women in particular, this is problematic. What is different about blood cancers is that the treatment is fairly extensive and brutal, frankly. And we're trying to raise awareness around that fact. I think blood cancers are difficult for all people, and the treatment is difficult for all people, but in particular for women, it is, the burden far outweighs that than for men. I think the big challenge for blood cancers and for treatment is that, the whole system is designed around the tertiary setting. So people will go in for treatment, then they're discharged. The problem with treatment in blood cancer is that there are a whole range of physical and psychosocial issues that people, not to mention financial issues, that people need to manage, particularly women. And, where the Leukaemia Foundation steps in is at that point, I guess. There isn't a lot of support offered through tertiary services for women once they've been discharged, or for men once they've been discharged. The system is designed to treat people in the most acute phase of their illness, but patients will repeatedly talk to us about the lack of support post-treatment. And if you move out to the regions and rural and remote areas, then things are much, much worse. There are very limited supports. The big challenge for blood cancer is the investment in research and the fact that we don't have a screening tool. So once you have a blood cancer, you're in treatment pretty much, whereas with other types of cancers, you can screen breast, bowel, etc. There are a whole range of tests that you can go through to screen for cancer, and you can get that early. But early intervention in blood cancer is not an option, unfortunately. When you compare the investment into other types of cancer, and by investment I'm talking about investment in research, blood cancer makes up 12% of the money that was allocated for research. So it's no surprise actually that we haven't developed an early detection tool, we haven't really made progress in terms of treatment. You know, we've made some progress, but there's certainly a lot more to make. You know, we're suggesting that, you know, $100 million needs to be invested in blood cancer research just to get it up to where other cancers are. It is a brutal cancer. It's a cancer that affects your bloodstream. It's not like you're talking about a tumour that needs to be eliminated. You're talking about a cancer that flows through the blood and it affects immunity and you know, normal bodily function. So this is a big issue for the country, and as we age, the incidence will increase. The Leukaemia Foundation is advocating for an increase in the research pool available for blood cancers, given that, you know, it's only 12% of the available funds. Given the incidence is increasing, we need to know more about blood cancer. We need to start focusing on early detection and early intervention where possible to get it up to speed with other types of cancers. Screening would be fantastic in blood cancers, and that's not available. The testing of people with blood cancer is inconsistent according to patients. So, you know, people can feel sick for a long period of time and undergo a series of blood tests and nothing's detected, only to be detected you know, 4 or 5 months, 6 months later, which means that, you know, in terms of treatment, they're behind the 8 ball. So as with other types of health problems, the earlier you intervene, the better the outcome. The other big challenge for people is the system itself. So we're advocating for more community-based support for people living with blood cancer, and we're in discussions with government, with all governments actually, state and territory governments as well as the Commonwealth government, to try and get those supports in place, particularly for those people living in regional, rural and remote communities.